I'm the president of the Louisiana Healthcare Quality Forum, which is a statewide organization that taps into the talent of volunteers and our staff to improve the quality of healthcare for everyone in our state. We are the state's designee for health information technology, which means that when big projects like creating an information exchange come to a state like Louisiana, the Department of Health and Hospitals looks to us to make that happen, to bring together in a convening all of the talented stakeholders to implement a project of this magnitude.
We still have a ton of paper. At the end of the day, I'm in healthcare facilities all day long, many days of every week, and I see paper everywhere. We're at the beginning of the curve. We need more and more activity around pushing paper out and moving electronic forms in. But it has to happen all over, not just in patient records. This is a good example right here in New Orleans. This is also vital records, birth certificates that were damaged almost beyond repair. If you see the back piece, this is as a consequence of Katrina flooding. And we've been in a multi-year process of digitizing all of the damaged paper records that we had. You know, here we're could be any dentist office, doctor's office around the country. This is what still we're dealing with on a day-to-day basis. This actually is in a clinic in an area that should have an easily captured population, and I mean that literally because this is at Angola State Prison, and the amount of paper records is staggering. And it's difficult because you have to hire in and contract in physicians to do chart reviews. So this is how papers are ready. Now, the thing is, they don't have to worry about having the velocity of patients cycle in and out and who's going to show up and what other doctor is going to get their patients, because almost all the people at Angola are there for the rest of their lives. So there's really a pretty compelling reason to have a solid electronic medical record that people will have for the rest of their lives. Even what should be on the cutting edge of technology like telemedicine, it's funny that telemedicine process gets slowed down by the amount of paperwork associated with it. Just that sentence is full of juxtaposition and paradox. But we need to move our processes that are administrative to catch up with where the technology potential lies. So we know that what the true information exchange is still alive and running today. It's the fax machine. We use it in the world of medicine far too much. And in some cases, we're mailing things back and forth or couriering things back and forth, whether they're images or lab results. That move needs to go more boldly and strongly to the adoption of digital forms to be able to use it properly to get those results that we wanted. Today is a very exciting day, and it's a great day for the healthcare system of Louisiana. We're moving today to launch the Louisiana Health Information Exchange. This will allow caregivers, primary care physicians, and clinical group practices and hospitals to exchange information. Imagine someone in the emergency department that presents with a complex condition, and today we would have to make a lot of phone calls, fax information back and forth. But after we stand up the Health Information Exchange, physicians, doctors' offices, emergency departments will be able to online exchange information instantaneously to be able to pull up a history for a patient, records on their either prescriptions or labs or images without having to make any phone calls or faxing around. This is going to make our healthcare system perform more efficiently and improve patient safety at the same time.
How would you characterize today's announcement?
Oh, this is an incredibly exciting day. It's the culmination of many years of work on the part of hundreds of volunteers and technical advisors to really see us as a leader in the nation. Louisiana is taking a big step forward from idea to implementation to see that information about patient health moves freely between hospitals, clinics, so that doctors can do what they need to do for the patient at the right time.
It is with tremendous pleasure that I launch for you the Louisiana Health Information Exchange. I want to take a few minutes and actually show you the system. I'm going to pretend to be a provider. There are different roles built into LaHIE. When a patient presents they will first be greeted by the registration clerk at the facility. The scenario I'm going to walk through is a patient presenting in an emergency department. So I've logged in as a provider. At this point, John Cardinal has already been checked in by the registration clerk. So I'm just going to search for him. And you'll notice in the search fields there are several different ways you can search. Last name, medical record number, so forth. So we've searched for John Cardinal, and we see down below his name, and if you hover over it, some basic demographics. So I can identify, yes, this is the John Cardinal that's sitting in front of me. If you look over to the right, you'll notice that he is listed as opted in. What this means is when he presented, the registration clerk gave him the opportunity to opt in or opt out of having his information shared within LaHIE. He has chosen to have his information shared and accessible. I will point out this is completely test data. We've made up John Cardinal, but we'll click on him to see some of the basic demographics and information about the patient. Because he's presented in the emergency department, I don't have a direct care relationship with him in the system. If I were his primary care provider, that information could have been passed through on the front end from the feeds that we're getting directly from the hospitals and the clinics, but we're in an emergency department, he's presented in front of me, I need to break the glass and give a valid reason for why I'm seeing this patient. So I'll say that it's an emergency, it's for direct patient care. I can add a comment if I choose. Once I've broken the privacy seal, I see basic demographic information on John Cardinal. You'll notice his medical record number at the top and his age along the screen. Here to the right, we see medical record number, basic demographic information. If he had two medical record numbers, if we had information from two facilities like Lafayette General and Opelousas General, we'd see two different medical record numbers here affiliated with those facilities. You also see right underneath the demographic information, allergies and alerts, information that is critical to see right away. What is he allergic to? We scroll down a bit, we see the encounters, the appointments, and insurance information. This insurance information is what was known at the last visit. It's not verified yet with Medicaid or Blue Cross or whomever, but it's just what was known at the last visit. On the left-hand side, or kind of the middle frame, you'll see a document tree. You can search here within the tree. If you know there's an electrolyte panel that you want to see for John Cardinal, you could search for that. You'll notice that it's red, the one that showed up. That shows right away at a glance that there are results that are outside of the normal reference range. If we click on that electrolyte panel, you notice when you hovered over it, a summary box popped up. If you click in it, though, all the labs in this panel are showing up. If there were multiple sources, we'd see different hospitals there. These are all coming from City Hospital. You'll notice up the top too, where the mouse is hovering now, City Hospital is showing. If we had Lafayette General, we had Opelousas General, both of those would be listed there. We could choose if we want to see just from one or from both. We can choose to, and Dee has already done this, graph a few of those lab results together. And you'll notice you can highlight and select certain date and time range within this time period, and when you do, the subsequent graphs update as well to reflect what you've zoomed in on. Again, there's a shaded area to show if there are results that are outside of the normal reference ranges. So if we go back to the document tree, you'll see what's displaying. We have the lab results, we also have microbiology results and radiology reports. So if you click on a radiology report, we see the details of what was done. Now, as a physician, I've seen what I need to see, but I want to get a snapshot. So in the same document view, I can go click on a patient snapshot of John Cardinal. This brings me to a continuity of care record that shows the results of just the results of the different medications, encounters, and so forth. There's no information populating here for John Cardinal because what this shows is the last 7 days. And John Cardinal is a test patient. The information that we have in is old, but we would have the last 7 days snapshot of John Cardinal. I can choose as a physician to download this CCD into my EMR directly. For meaningful use, for EMRs to be certified, they have to be able to consume a CCD, so LaHIE offers the way for them to download that CCD into their EMR. You can also choose to download it in an XML version or print to a PDF. So I've seen the snapshot, I've finished my assessment of John Cardinal. One thing I want to point out too is, as a physician, I can sign up for notifications and subscriptions within the Health Information Exchange. So in this situation, the scenario where John Cardinal is presented and I had to break the glass as an emergency physician, I won't be able to sign up for notifications specific to him. But if I were a primary care physician or I had a relationship with this patient defined already, I can come in here and choose subscriptions for 6 notification events: admitted or discharged from hospital, admitted to an emergency department, a final radiology report is available, final lab result, or a final micro result. You'll see at the top I can choose by default how I want these notifications delivered and the frequency of that delivery. So I would say by default, I just want a daily summary email of all my notifications. But then down below, I say I want to get all the notifications. But maybe for inpatient admission, I don't want to wait until the end of the day and get a summary. I want to know right away if one of my patients is admitted to the hospital. So I can go in and customize it for that specific notification. So if I save these changes here, there's also an option for me to set these notifications up based on my relationship with the patient. So if I'm the referring physician, the primary care physician, the admitting physician, or the attending physician, I can customize my notifications the same way depending on that relationship. So going back to John Cardinal a bit, I finished my assessment. I want to refer him to a specialist. LaHIE offers the capability to do secure messaging, where I can send a message to a specialist who, if that specialist also has a care relationship with John Cardinal, he or she can see the details that LaHIE has for John Cardinal. You'll notice it shows received messages, sent messages, and so forth. I'm finished with John Cardinal. I've completed my assessment. It's time to move on to the next patient. I go back to the patient search and do it again. So what I've shown in a 10-minute demo would take how long today? If a patient presented to an emergency department, didn't have a relationship, we knew lab results existed, we didn't know what allergies he had, there would be, I would guess, more than 10 minutes worth of time put into that to find that information. So this is LaHIE. It's live today, and
I'm very excited. This has been going on. There's been a lot of involvement with stakeholders that have been involved with this, and they are just excited about the fact that it's becoming a reality today.
One of the things that's missing in healthcare is really this linkage between providers. Health is really about providing care across the community. We're not individuals providing care or individual hospitals providing care, but it's really a community providing care. Before the Health Information Exchange, we weren't able to reach across and find out what our brethren engaged in these efforts were doing, and therefore we were unable to give the kind of care that was coordinated and that's reached across the different areas of care provision in the state.
We certainly saw the vision of LaHIE and what it can do to improve the health of the community in Acadiana, and it was important for us to really be a first mover, an early adopter of this technology, and the hope certainly is that we show such success in Acadiana that this is replicated and quickly gets rolled out across the state.
What's this going to mean for patients?
Well, I think improving health, and certainly for a lot of patients, particularly as we look at rolling in medications and past histories, there's going to be a lot of information we have at ER visits in the future that has not been available, and that we're going to make sure that we actually avoid mistakes and improve care at Lafayette and in Acadiana.
What advice would you have for other hospitals?
Well, I think the folks certainly at the forum and the folks at LaHIE have been wonderful to work with as we look at interfacing the technologies. One of the things that we all need to think about is meaningful use, and certainly the first step of it is relatively easy because you can control what you do inside your facility, but LaHIE really gives you the ability to begin sharing information amongst providers and hit meaningful use in those next stages.
We were approached by the Louisiana Healthcare Quality Forum to be a part of this project as pilot participants, and we felt that it was important to share data with our clinically affiliated hospital in Lafayette General. And at this time, we are excited about the opportunity of sharing data between our ED facilities so that we can have more timely access to patient diagnostic results, and the physicians at each end of the spectrum of care have immediate access to improve their patient care.
What advice would you have to other hospitals?
I would encourage all Louisiana hospitals to join the Quality Forum and in this LaHIE project, because I think it's very important that as many hospitals join into this program, the better patient care will be in Louisiana.
What is this going to mean for the actual patient that comes to your hospital now?
Well, in the future, the actual patient will be able to get online to a portal and have access to their diagnostic results. And I think that the more information you have as a patient, the better you can manage your health care.
We're starting locally with a pilot in the Lafayette area, but it will be statewide.
What's your reaction to the launch itself?
I am thrilled. It is extremely exciting. This is a step in the right direction for improving the way healthcare is delivered in Louisiana.
We think long term that this is going to really benefit the state in terms of reducing duplication of testing and providing necessary information so physicians and providers have everything they need to make decisions about a patient's health care.
Are you excited about today's announcement?
I'm so excited. My family lives in Louisiana. I've been in Louisiana and come through Katrina with my family. This is a big deal, and very excited, very passionate about what's going on in Louisiana.
This is historic for the state. We're one of the first states in the country to be doing it, and this is exciting. This is years in the making.
This is just another feather in our cap in terms of Louisiana's accelerated pace of being one of the best states in the nation for health information technology. This shows what our true potential is as a state in the world of healthcare, and we could move forward from our low levels of health outcomes today to high levels, and we're showing our potential through what we're doing in health information technology.
We are on track to do this within the next 90 days. We're going to start it in southwest Louisiana, where they're ready, willing, and able, and then roll it out statewide.
Go to our website, www.lhcqf.org, or call us at 225-334-9299.